Everyone, we're going to, in a series of videos, go over the process of gowning and garbing in preparation to enter a clean room. This video will just kind of be an overall 30,000 foot view. I'll have a couple separate videos where I'll go over hand washing in more detail, as well as donning sterile gloves, which is the last part of the process. But we'll do everything else here. So first thing is you should remove all jewelry and outer garments before you even start this process. Ideally, you would not be wearing this to work in an IV room. You'd probably be wearing scrubs. But apart from your scrub top, you wouldn't want a fleece or anything like that over top of that. You would have to remove that first. All right, once you've done that, you're ready to don what I'll call the auxiliary personal protective equipment, or PPE. And those are shoe covers, bouffant, which goes over the hair, and then a mask for over the face. And it's important that we don these in that very order. So we'll start with our shoe covers. They're kind of one size fits all. So you typically don't have a choice for these. You'll find that kind of one end has a little bit more space in it and your toe goes in there. All right, then we're going to put our bouffant on. This covers the hair, make sure it's kind of back underneath the ears. And the last thing we're going to put on is a face mask. You'll notice that there's kind of like a metal underwire on one end of this face mask. This part's going to go over your nose because you can actually like pinch it to form the contour of your nose. So we'll do that, pinch it, it'll make it a little easier. You have two straps, two tie up top here on the top end of the head. And then you got two straps that can be tied in the back. Kind of around the back of your neck. Always takes a little practice to to tie around the back. So if you don't get it, that's okay. We're looking for you to kind of understand this process. Sometimes it might struggle a little bit. You can move on. It's all right. So at this point, we would be ready to go over to our sink and do the hand washing procedure, which is in a separate video. So once you've done the hand washing, come back and you're ready to put on a glove. In the room, you will have a choice, a gown. In the room, you will have a choice of a small or large size gown. This is the large size here. So pick your poison. I'm going to don this. You're making sure at this point you've washed your hands. You're pretty clean. You don't want to be touching anything around you. All you're touching is the gown, which would typically be in a sterile package first, and you would unwrap that. But this would be sterile, but you wouldn't want to be touching other things in the room around you. You'll notice these these gowns have some Velcro at the top, so those can be fastened in the back behind your neck. All right, and then you got a couple ties here. The easiest one is there is a long one in the back here that can be pulled around to the side, and you can tie it to here. And tie it at your side, easiest to get to. And then you're actually ready to first use some antimicrobial hand scrub on your hands, and then donning the sterile gloves, which will be the final video. Thanks.